'Tis the season for back-to-school preparations like the school and sports health exams. It's one of the many services of Milan Medical Group. Ashley Ebert is a nurse practitioner there, and she's here today to help us through some of this stuff because you never know when you're going to need, and this is a walk-in type situation at your place.
Yeah, we're an integrated wellness center, so we've got a lot of different specialties under one roof. We've got urgent care, family practice, we have a mental health provider, which is huge in the area.
Wow, mental health.
Yeah, we've got optometry, chiropractics, whole slew of things.
Don't you though?
Yeah.
Wow. So what's your specialty there, Ashley? What do you cover there at the
So I do urgent care. And currently working on some business development this fall, looking to start cosmetics and occupational medicine as well.
All there from the one building, the one
All
location.
in Milan.
It's a one-stop shop.
We are.
Yes. In the previous segment, you could get your bath remodeled in Milan, and now you can go see the doctor in Milan. So urgent care. What have you been seeing this summer?
All of your typical summer things, your broken bones, your lacerations. Unfortunately, still seeing a little bit of COVID trickling in, but business as usual.
What are you doing for COVID these days?
CDC's updated guidelines. So right now, if you are positive, you have to quarantine for 5 days, followed by 5 days wearing a mask. Some of our higher risk populations may be eligible for the Paxlovid, which is the antiviral. That's typically prescribed through their family doctor.
Other than that, if someone's feeling, because we all have known several people recently who've gotten this new strain of COVID, when they come in because they feel so crummy, is there anything you can do? Besides that, you mentioned the antiviral, but not everybody can get that?
Yeah, you can. It's kind of risk-based, but we'll test you, and it's more just conservative management at home. Some of our higher risk patients we can refer on, or for some patients, we do have IV hydration therapy as well.
Is that right? Okay, all right. Well, let's talk about there's the picture of the outside of your place. Describe the location, where you are, Ashley.
Yeah, we're right off the Milan Beltway and Andalusia Road, so very convenient to most of the Metro Quad Cities area, but we also service a wide area outside of the Quad Cities too, some of those smaller towns that feed in.
Oh, I bet, sure, because you've got it all. Now, when you say urgent care, what are your hours for that?
So we're Monday through Friday, 8 to 5.
Okay, so if you have an urgent need, get in there between 8 and 5.
Yeah.
Because they'll take care of you right away. I mentioned the school exams and the sports exams. Now, the sport ones, you were saying to me that you could just walk in for those.
Yes, we do sports physicals on a walk-in basis, or if it's more convenient, you can schedule those as well. Okay,
and how about for the kids who need it for a back-to-school situation?
Yeah, so we can schedule back-to-school physicals through our family practice providers that are at Milan, and then the sports physicals, we can do those on a walk-in basis, which is really nice because, I've got a couple kiddos and I know how that goes. A volleyball camp or something comes up on Monday and you got to have that physical. It's nice to have a walk-in option because a lot of family practice offices are booking up this time of year.
That is a good point. And you serve anybody who comes in. It doesn't matter where they live.
Yep. We do.
Okay, all right, good. So the other thing is that, I'm just thinking about how important it is to have this well-rounded kind of care that you guys offer. Does that work out well with the chiropractic in there and the mental health component and the eye doc?
It does, yeah. It really pulls into our vision of holistic care of a patient. It makes it very efficient for patients too. Like I said, we're pulling from a lot of those smaller towns, so to be able to come and have that one-stop shop is really important.
I know you're passionate about your work as a nurse practitioner. You used to be a business owner.
I did used to be a business owner. Yeah.
Ashley was here on the show. It's been maybe several years ago.
Probably like 5 years ago.
Yes, right. And now you're just fully in the healthcare field. Do you love it?
I do love it. But I think that's kind of the beauty of Milan Medical is that we're very progressive. Like I said, there's always opportunities for business development, which I like, and lots of exciting things coming down the pipe this fall. So.
Well, yeah. Do you want to mention anything else about the cosmetic stuff you're going to do over there?
We're going to be starting with Botox, hopefully in September.
There's a call for that here.
There is a major call for that here. Yeah.
You know who you are. You might not be telling everybody, but you know who you are.
Yeah.
So Ashley does that, and she says she does a good job at it. So that's good to hear. So we're talking about Milan Medical Group, and it sounds like a cool place, right? So there's the info. You can just go online. You can look them up if you want to, learn more more that way. Otherwise, stop by.
Yeah, we're happy to have you.
They'll take care of your poison ivy and your sprained ankle and your
broken back and your eyes.
Oh my goodness! And give you a little mental health counseling, and you'll be all fixed up.
Yeah.
Ashley, thank you for being here today.
Thank you for having me.
Thanks.